Hello, good afternoon, and welcome back to part two of the Okanogan County Public Health and Washington State Department of Health COVID-19 vaccine webinar. My name is Jessica Kuzma, and I'm part of the Okanogan County Public Health's COVID-19 communication team. And we are privileged to have our three speakers from last week with us again. Dr. Bob Lutz is here, who is currently serving as medical advisor for Washington State Department of Health's COVID-19 response. We have Dr. John Merrill-Steskell with us again today, a family physician in Ellensburg, Washington with Kittitas Valley Healthcare. And Elias Cass is back with us, a naturopathic doctor and CDC childhood immunization champion in the Seattle area. Additionally, we're excited to have Dr. Jim Wallace joining us today. Dr. Wallace is a family physician currently serving as clinician and medical director at Family Health Centers. And Dr. Wallace is also our Okanogan County Health Officer. So thank you all for being here today and sharing your expertise with us. Just a side note, I know many of us are dealing with additional stresses of wildfires and poor air quality right now in our communities. So just want to acknowledge that and thank you for joining us for the next hour as we discuss strategies to increase COVID-19 vaccine uptake in our communities. So Okanogan County and public health departments across Washington State continue to promote the importance of vaccination to end the COVID-19 pandemic. And just yesterday, in fact, Governor Inslee and Secretary of Health Umair Shah announced a new Power of Providers initiative to highlight the important role that healthcare providers and workers are playing in vaccinating patients and communities. So as we shift away from mass vaccination sites and more towards clinic and community-based outreach and vaccine efforts, each interaction that patients have with a healthcare provider is an opportunity for that provider to have a conversation about the vaccine. And so it's really our goal with these webinars to help each of you feel more prepared to have these vaccine discussions with patients. And we hope you'll come away with credible resources about the vaccines that you can share with patients and learn from others' experiences about what works and what doesn't work when engaging in these conversations with patients and community members. So we'll start our session today with a discussion among our four panelists. I'll ask a question to one or two of our panelists, and after they answer, I'll pause and allow time from anyone from the audience to ask a follow-up clarification or question. And then after that, we'll break up into small discussion groups. You'll be placed automatically into a room with one of our panelists and several other participants. We'll ask you to turn on your cameras at that point and participate in a group discussion. Just a reminder that the breakout sessions will not be recorded. Okay, so I think we can move to the next slide, please. For those of you seeking continuing education credit, information about obtaining CEs will be available at the end of the webinar. You'll be receiving an email tomorrow with a follow-up evaluation form and more information about receiving credit. The planners and speakers of this activity have no relevant financial relationships with any commercial interests pertaining to this activity. And this continuing nursing education activity was approved by the Montana Nurses Association and accredited approver with distinction by American Nurses Credentialing Centers Commission on Accreditation. Upon successful completion of this activity, 1 credit hour will be awarded. And this program has also been granted prior approval by the American Association of Medical Assistants for 1 administrative continuing education unit. And this training was approved by the Washington State Pharmacy Quality Assurance Commission for pharmacist education. Upon successful completion of this activity, 1 credit hour of continuing education will be awarded. Okay, so I think we can stop the slide sharing now and we will begin our questions. So I think my first question to get us started is regarding COVID-19 boosters. So maybe Bob Lutz, if you could start us off and give us your insight about our current understanding of COVID-19 booster shots, who might need them and when, and what we can tell patients when we're asked this question.
Yeah, Jessica, and good afternoon. And I do empathize with all of you in Okanogan County with the wildfires. We have a cabin in the Methow, and so we are monitoring it very closely as well. So we keep our fingers crossed. Yeah, so great question, Jessica, about boosters. I think there are 2 sort of ways to look at this. First of all, we know that there are some individuals, those who, for example, have weakened immune systems, they may need a booster. We've seen this with other vaccinations. So that's one population that, again, we may be looking at boosters at some point in time. And I can tell you right now that there are currently trials on looking at the effectiveness of boosters in a variety of different settings. So I think, we will see more research coming out about the need for boosters for the populations, primarily those that are immunocompromised, maybe the elderly whose immune response may not have been primed enough by the 2 vaccine series or the 1 vaccine Johnson. I think the other area that we are having increasing concern about are the variants, and specifically the Delta variant. Preliminary data coming from across the world, but especially coming from the United Kingdom and Israel, have shown that not only is the Delta variant more transmissible, but we are seeing breakthrough infections. Those are infections in people who have already been vaccinated. We know that the data have shown that, for example, with the AstraZeneca vaccine, after only a single dose, you have a much lower rate of preventing disease than what you see with, for example, for the Delta variant, than you see for some of the other variants of concern. You do have, however, good response if you get both doses, albeit the Delta variant, it still gives you a lower vaccine efficacy of the 2-dose series. So I think that for me, the take-home message is that even prior to variants, there was interest from the pharmaceutical industry, from researchers. We still don't know how long the immune response to the vaccines lasts. Then we know that there are inherently some populations that are going to have a weaker response. Further complicated now by the Delta variant, and who knows, whatever other variant come down the road, ongoing research around need for boosters going forward.
Great, thank you. So partially a nuanced conversation, talking with the patient and assessing their personal health history and laying out all the different reasons why the booster would be preferable perhaps for their situation. Thanks for that. Dr. Wallace, do you have anything to add to that or comment?
Yeah, I've had patients ask me about the booster and if the booster is right for them. Is it time? When will they know it's time to get a booster? And I share with them that it's normal to get boosters for vaccines, and so we get a booster for a tetanus vaccine. We get essentially a booster every year for influenza. It's very similar if we indeed start giving boosters or additional vaccines for variants that change enough to warrant that. So the idea of getting a booster is something that's common in immunology that we see frequently. It doesn't mean that the vaccine doesn't work. It just means that we're staying on top of it and we're updating the effectiveness as we learn new information about this virus and its variants. The source of that new information, Dr. Lutz mentioned the UK and Israel, but I point to our very own Department of Health because we are one of the strongest states in the country in providing surveillance and sequencing variants and understanding how effective the vaccine has been on the ground in Washington in our population. We've even started doing more sequencing in Okanogan County. We know that the Delta is here, but we're not seeing as much vaccine breakthrough as would suggest that our vaccine is not effective. And so we don't see a need for a booster right now. But as soon as we start to see more breakthroughs or start to see evidence that the vaccine is less effective than it has proven to be so thus far, then we'll start to consider the need for a booster, and then I'll make that recommendation to my patients.
Great, thank you. And I'll maybe just pause here for a moment. Does anyone from the audience have any follow-up clarification or question on boosters? Feel free to chime in or put a question in the chat, either way.
I'd like to just make a big picture comment about boosters and the vaccine efficacy. I think it's worth noting and sharing with patients that around the country, 99% of hospitalizations from COVID are in unvaccinated individuals. And the states that are experiencing the worst COVID spikes are the states that have the lowest vaccination rate. So that's testimony to how well these vaccines are really protecting us and worth being part of any conversation.
Thank you. That's a great point. We're working hard in Okanogan County to illustrate that point in a respectful and educational way. So thank you.
I think it's also worth channeling some of the concern about boosters and into trying to get the people around you, if they haven't been vaccinated, trying to get them vaccinated. Because getting the whole community protected is going to be much, much more effective than boosting individuals. So talking to your friends about how you got your vaccine, how you came to the decision to get the vaccine, how you felt, like if you had side effects, but also the relief that you felt after getting vaccinated, and just trying to make sure that your whole community is protected.
Absolutely. Thanks for that. Okay, so along those lines, kind of talking about discussing side effects with patients, and specifically in certain groups that have shown to be at higher risk for some of the side effects that emerge. So I'm speaking specifically about young women with some of the risk of blood clotting arising from Johnson & Johnson vaccine, or young men with pericarditis after the mRNA vaccines. So I wonder, John, if you could just talk a bit more. I know you did a great job last week about putting some of these risks, this relative risk, in the context for us about side effects versus benefits. But if you could just talk a bit more about how we address those specific concerns in conversations with patients.
Sure, happy to. To talk about each situation separately regarding women and the risk of these blood clots, I think the first thing to do in those conversations is to acknowledge that it is indeed a risk. It is a real concern, and that I love to use these opportunities to highlight how well our country's vaccine safety system works in terms of identifying this blood venous thrombosis problem, and how it was identified in a timely fashion, and the CDC put a pause on the vaccine and then chose to resume vaccination, and share why they chose to resume vaccination, that the overall risk of COVID and complications from COVID is much higher than the risk of an adverse side effect from the vaccine. So, and then I like to use that comparison with birth control pills. Again, the risks of taking oral contraceptive pills are actually higher than the risk of having a blood clot problem from the Johnson & Johnson vaccine. So that can help. But even so, we have such great vaccines, and we have a couple of different options these days currently, that if a woman was concerned still enough to be hesitant to receive the J&J vaccine, there's nothing wrong with suggesting that they get the Pfizer or Moderna vaccine, which does not seem to have this same problem. That's the best vaccine for an individual is the vaccine that ends up in their arm, is kind of the saying. So reviewing those risks, putting those risks in perspective, highlighting our country's vaccine safety system and how well it's working, but then acknowledging, recognizing that if that woman continues to have concerns about receiving the vaccine, there's another really great option, and that's the messenger RNA vaccines. So, and regarding the mRNA vaccines and myocarditis for young individuals, I think that conversation is similar in that highlighting how well our safety system is working, and putting that risk in perspective. For this particular adverse event, it is a situation of much lower health consequence than the thrombosis syndrome, in that most all patients with myocarditis experience relatively mild symptoms, and virtually everyone has recovered uneventfully. So it doesn't seem to be quite as serious of a problem compared to the thrombosis concern. And I think, issues that might come up, well, as a child, what's the big deal? Getting COVID seems to be milder. They're rarely hospitalized. Why get the vaccine? And then there's this myocarditis risk. Well, it's not so straightforward, because there's this. I think it's worthwhile sharing the information about the multi-system inflammatory syndrome, which we don't really have a great handle on the true incidence of this, but it may be as high as 300 cases per 1 million COVID infections in young individuals, which is a much greater risk than myocarditis in vaccinated individuals. Myocarditis is a milder syndrome compared to the multi-system inflammatory syndrome, which is quite serious and life-threatening. So having that kind of conversation with parents or young individuals can be helpful, and that COVID is not necessarily a harmless infection, or an infection of little consequence for young individuals. And by getting vaccinated, those young adults are protecting their older family members, their older community members. Like Elias has shared, that it's community immunity really does matter, and we all have a role to play. So at any rate, I hope that those kind of tips are helpful in talking to individuals about those particular side effects or possible adverse events.
Thanks. That's great. Putting that into perspective of the relative risk and other behaviors that we do daily is really powerful, I think. Bob, did you have something to add?
Jessica, John did a great job of covering it. I think something that you just pointed out, we take risks every day. And I think if you can put people's daily risks into perspective, then maybe it allows them to kind of frame the issues around both the syndrome associated with the J&J, the thrombocytopenia, thrombosis for women. So for example, that's estimated that the incidence of that, so the risk of that is what's the number here? I want to say it's 1 in 7 million. I'm sorry, 7 per million. So, that's an incredibly small number compared to some of the risks that people take upon themselves every day. Likewise, if you look at the myocarditis, pericarditis, which we've seen, there's been about 1,000 cases total. As John said, the vast majority have been mildly symptomatic with great recovery. And yet we also know there have been, millions of doses of the mRNA virus vaccines given. So I think, having the conversation, understanding where people's risks are, and then putting their risk perceptions into the picture of exactly the risk associated with these vaccines. And conversely, as John said, likewise, the risk of getting COVID. Something we're learning more and more about are these long COVID symptoms. And, again, the studies are showing that significant percentages of people will continue to have a or multiple symptoms for months, maybe a year plus. So I think we really need to put things in perspective, but unfortunately, a lot of hype occurs around these adverse events around vaccines. But once again, to John's point, we have a good system in place that was able to identify a very small signal. For example, 28 people identified from that clotting disorder. So that really tells us that the system, when utilized, works well.
Excellent. Thanks, Bob. And I'll just pause here if anyone from the audience has a clarifying question or any of the other panelists want to chime in as well, feel free. Okay. So our next topic, I think let's move on to vaccines in kids. So we touched on that, John touched on that briefly, but Elias, Dr. Cass, why don't you walk us through how you handle vaccine discussions with parents when they ask, given that there are very few COVID-19 outbreaks in schools, for example, why should their 12-year-old or younger child receive the COVID-19 vaccine?
One of the things that we're seeing as time progresses and as more and more adults are vaccinated is that an increasing percentage of the cases are in kids because they are the people who are unvaccinated. And so we can pretty much depend on COVID coming to wherever you are. It's extremely effective at spreading, especially the Delta variant. So even if there haven't been outbreaks in schools, like when did your schools reopen? Like how open have they been? Have they been wearing masks? We are sort of unmasking and undoing a lot of the protections that have been in place right at the moment when people are still vulnerable. Sorry, my kiddo, I think, is having a hard time. I'm gonna hop off and then I'll come right back and I'll pick this back up. Sorry.
Okay, no problem. Dr. Cass's child's school actually just had to close for a positive case, so kind of interesting timing. But yeah, so why don't one of our other panelists chime in there and talk about vaccines in kids?
I can say a few things. I think to pick up where Elias left off, what we do know about vaccination in children in general is that kids have great immune systems, and vaccinations tend to produce much better immune responses in kids versus adults. So anytime we vaccinate a child, we know we have a much better sense that we're protecting them very well. And what's more, we're protecting their family and we're protecting people around them. I was reviewing some of the research pearls about COVID in general since the pandemic began. And one interesting little data point that stuck out to me is that for people infected with COVID, approximately 40% of those people were infected from individuals without any symptoms. So as Elias said, COVID spreads very easily, and kids are incredible vectors of disease. They do a really good job sharing germs. They don't do a very good job washing their hands. And that's not just 5-year-olds. That's teenagers as well. So by vaccinating young people, we not only protect those kids, but we're protecting the rest of the family. We're protecting the grandparents. We're protecting the community, and it's a big step towards ending the pandemic. As far as safety issues, again, so far, really good news that these vaccines seem to be very safe in children, in adolescents and teenagers. The only kind of minor issue identified, from my perspective, because it has had minimal health consequences, that myocarditis risk, which is very rare, and we're still learning about the true incidence, but it may only be a few cases per million over the baseline myocarditis rate in our population. So these vaccines do seem to be safe. They seem to be very effective. And I think vaccinating kids is really important to truly putting the lid on this pandemic and serving our communities. Elias, it looks like you're back, so I'll turn it back to you for additional comments.
Yeah, so in my experience, the teenagers really want to be vaccinated. I mean, the day that those vaccines became available for 12-year-olds and up, right? Like Lumen Field in Seattle was flooded with kids just going down there to get vaccinated, right? Like kids are smart and they want to be protected. One of the questions that we get really frequently is, when will vaccination be available for the younger kids? And so that has been, I mean, we were sort of hoping for fall, and now it seems like winter. Hey, buddy, I'm talking. You want paper? You can have paper.
There's a thing of permanent markers.
Here's a permanent marker right here. Do you want to get vaccinated when the vaccine is available?
Yeah.
Yeah. Do you have to wear a mask all day at school? Yeah. So kids know that coronavirus has put a real cramp on their activities, on what they're allowed to do, on where they're allowed to go, and they want life to go back to normal as well. So it's really, really important for the kids to be vaccinated. When we talk about the unvaccinated population, it's not just the hesitant, it's the hesitant, the refusers, and this enormous body of the population that's under 12. And so as people are sort of going back to normal, as the state is reopening, as people are starting to travel again, hey buddy, you can take this marker right here. And then as soon as I'm done talking, we can do more markers. As people are starting to travel, I think that families are feeling like they're immune because the adults are vaccinated, and then they're traveling, and then they're bringing back sick kids. And those sick kids are the ones who are spreading it among the persistently unvaccinated kids because the vaccines aren't available. That's what happened at his daycare. As a family went and traveled, came back, and the kids came back sick. So the vaccines for kids are really, really important. And I think we're all going to have to put pressure on the FDA to commit to reviewing the data that will be available in a really fast way. They're not going to skimp on the amount of data, but they really need to be quick about how they're evaluating it. They need to put lots of resources into evaluating the data so that we can have these vaccines available for kids. And they're also studying smaller doses for the younger kids. So it's not quite as straightforward as it was for approving it for the 12 to 17-year-olds, because that was the same dose. So there's a lot more data that will need to be reviewed. But I'm really hopeful about vaccines for the 6 to 11s by sort of New Year's, and hopefully early next year for the younger, the 2 to 5. I'm going to show you a picture of Rowlett. This is what we're doing now. Watching a lot of Pokemon drawing.
I love it. Thank you. Yeah, great points. Anyone else from the audience or our other two panelists have anything to add?
Just from a local perspective, I'd highlight something Elias mentioned, and that is that we are withdrawing a lot of the protections we've had in place. And I don't think we protected any population more than we protected our kids in the past year. A lot of people tell me, well, kids are much less likely to get it. It's not as severe when kids get it, but we really did a good job of protecting kids, especially in Okanogan County last year. We didn't have to shut down a single individual school because schools did such a good job in all of their precautions that they took. They even closed some of their classrooms to prevent outbreaks in the rest of the school. And so, it's not that we're not going to be cautious in our schools, but we're going to have less masking, probably more people and less distancing in schools this year. And so all the more important for us to vaccinate kids this year. We did, if you look at the last couple of weeks and months, Dr. Larson and Dr. Butler, other health officers locally started responding to a lot of cases when some of those restrictions for sports started to loosen, because we had a lot of traveling teams and a lot of kids getting back to usual kid activities who were unvaccinated and then were parts of some larger multi-county outbreaks. And we'd love to avoid that in the coming school year.
Absolutely. Thanks for those points.
And Jessica, I'd like to just add a small, but I think important concept in talking with patients. I love what's called the miracle of the pneumonia vaccine, sharing the story about this vaccine and how it can relate to the COVID vaccine. So the PCV13 vaccine, when it first became available for children, the intention was to vaccinate children to reduce bloodstream infections, pneumonia, and what the epidemiologists saw was that, yes, it was very effective in reducing those diseases in kids. But the miracle part is that in vaccinating children, we saw a similar decline in the graph for adult pneumonia. In other words, by protecting kids and reducing disease in the kids, we had a profound impact on reducing disease in adults. And I think that's what we can probably anticipate to see with COVID vaccination in children. By vaccinating children, we reduce the disease in the kids, but in doing that, we reduce how the spread to adults and reduce the disease in adults. So kids have an important part to play in reducing the overall population burden of COVID-19. So, and we see similar effect with vaccinating kids with influenza as well, but it's probably best illustrated with the pneumonia vaccine.
That's a great example. I hadn't heard that before, so thanks for sharing that. Okay, so our last little topic here before we go to breakout groups is about our patients who have had COVID. So patients who have had it and don't think they can get it again and are wondering why the vaccine might be relevant for them. So I'll just have Dr. Wallace and Dr. Cass maybe chime in about this before we ask our other panelists.
Sure. Big question that comes up tons. And I think it comes from patients that are questioning whether it's worth it to them just to go ahead and get COVID and then have that natural immunity and not have to get vaccinated. Or some people have the assumption that, hey, I'm going to get it at some point in time, and then if I get it, then I'm safe. And so I share with patients that, yes, I've had a lot of personal patients that have gotten it more than once. I have more patients that have had a second case of COVID than I do who have had breakthrough cases. And that's my personal experience. It's not evidence-based, but I think that resonates well with patients, and there's data out there to support that. So there's a Norwegian study that sticks in my head that looked at people that had been positive in one surge that the country faced, then became positive in a second surge, and it looked like natural immunity conferred about 75% protection, which is less than what we see with our vaccines. And so I share that with patients. Also, that we only know that there's natural immunity in place from getting the infection for about 90 days or 3 months. It's probably pretty good between 3 months and 6 months, but then after that, it's like all bets are off, especially as we see new variants coming through. And it's hard to know whether the immune system is really strong for the type of COVID virus that you got and might not be as strong for variants. But we're more certain with that data with the vaccines. And so I'm asking people not to compare the effectiveness of the vaccine to effectiveness of natural immunity, because it's kind of comparing apples and oranges. But we know that it is possible to get COVID a second time, and there's some studies that are going to support that getting it a second time can be worse. I remember reading a report from a nursing home earlier this year, and the report was that in the small numbers, but in those residents who contracted COVID a second time in a second wave through the nursing home, each of those cases was worse than the resident had experienced in the first round. And so that could be applicable to the general population. And most people would agree that they don't want it to be worse than the first time. If you talk to folks that have experienced it once, they don't want it again. And I think that is relevant to entire communities. And we've seen that communities who experience a surge, again, this is not scientific, but communities in Okanogan County that have experienced a surge don't experience a surge the second time when the rest of the counties do. And so we know that the south part of Okanogan County, Brewster especially, really saw a huge surge in the summer of last year, this time last year. When we had our big surge in the winter, folks in Brewster were more protective, more cautious, and did a better job at avoiding it. And we did not have as many cases in Brewster, not because there is natural immunity, because not enough people were infected in Brewster to get herd immunity, but because people were really smart. They didn't want to have another experience like they did. And so I think whether it's individually or collectively, I see a lot of people trying to avoid getting that second experience with COVID, infected a second time, and vaccine is a way that you can ensure success in that.
I think it's also really important to stress that it's safe to get the vaccine, even if you have a history of infection. Sometimes people are worried about the severity of side effects, like, oh, if the infection is worse the second time around, or if the second dose of vaccine is more uncomfortable, then what is it going to be like if I have a history of infection? But it is safe to receive that vaccine, and that vaccine-induced immunity is better and longer lasting than the infection. So while I know initially everybody had hoped that the natural infection would provide protection, that does not seem to be the case. So it really, really, really is important to get vaccinated, even if you've had it before.
Thank you both. I'm going to close off this portion right now, just so we can have time in our breakout groups. If anyone has additional questions about vaccination after infection, we'll continue to talk about in groups. But so sit tight. You'll be automatically placed into a group with one of our facilitators, and we'll continue these discussions for about 15 minutes or so. Thanks. Welcome back, everyone. I'm sorry for the participant in the group that I was just in. We got a little cut off there at the end, but I hope there were some good discussions and dialogues there to learn from and to use. Challenge everyone to take away some tidbits from this session and try something maybe different in your conversations this week. We've had a lot of requests for resources, and Elias is just putting a bunch of stuff in the chat right now. And he also had a great list from our presentation last week. So the recording will be available. We'll make those slides available this week as well, but a lot of really great resources for you to pull from and to share with patients and get more ideas to share that credible factual information. So just in closing, maybe we'll do a real quick round robin. I'll just call again on the team captain from each group to give us a quick little take home tidbit. So John, why don't you start us off with your group?
We had a great discussion about just how to talk to patients about the vaccines and some concepts of motivational interviewing, asking permission, asking about questions, sharing personal stories, we had Dr. Larson's great insights as he interacts with the community a lot, and gosh, I'm having a mental blank on the rest of the topics. Anybody from our group have any additional parts that I'm forgetting that we talked about? But those were some of the main concepts, I think.
Great. Thank you. Dr. Lutz, what did your group talk about?
Yeah, thanks, Jessica. Yeah, I mean, I think, to John's point, there were a lot of good questions, a lot of good comments. I think for me, one of the, I'll say concerns is that some people actually express some hesitancy about talking to some of their patients about vaccines because of anger, or because they potentially see that as an impediment. I mean, they've had really good working relationships with patients, and yet sometimes because of at times the hostility around vaccinations, they don't want to ruin or break that relationship. And so how to navigate that sort of tense moment. But again, I think at the end of the day, everyone was talking about the continued need to really continue to encourage, probe, and really encourage not only for their individual benefits, but also for the greater good. So.
Thank you. Excellent. Dr. Cass, why don't you chime in here and give us your takeaway points?
Yeah, I put a phrase in the chat that we were just talking about, which when people have concerns about the vaccine, and it's outlandish or it's not real, one of the things you can say is like, yeah, I can understand how you would think that. That's not consistent with what we understand about the virus or with what we understand with the vaccine or what we see with the vaccine. That's not consistent with what I've seen with my patients. And it's sort of a non-confrontational way to provide your disagreement without saying like, that's insane, that's ridiculous. We talked a lot about the variants and about the timeline for vaccines for kids. Also about the timeline for the FDA giving full approval for the vaccines that currently have emergency use authorization, that some people are reluctant to get vaccinated because it hasn't been fully approved, and how the virus has not been approved either. And there was one other thing that we've talked about that has now escaped me completely. Oh, that these side effects, that they get a lot of press and they are very rare. And because we have given so many millions of doses of vaccine, these 1 in a million events, we see them more than once because we've given so many millions of vaccines. And so for people who are concerned that it wasn't studied enough, or that it doesn't have full approval, it's like, well, we've given so many millions of doses with this emergency use authorization. Whatever rare stuff was going to come up has almost certainly come up by now. And that you are not like a cutting edge, bleeding edge adopter of this technology. You are bringing up the rear. Lots of other people have had this vaccine, and it's been tested so much more because everybody has gotten it. So this isn't something that like 1 or 2 people in a town have gotten. This is like so many millions of people around the world with so many different safety programs, all watching the vaccinations happening in their country and their region. Like the widespreadness of the vaccination, the mass aspect of the mass vaccination has really provided us with a lot of data about what to expect. And so this isn't new anymore.
Thank you. That's excellent. Excellent context. Appreciate that.
Oh, and this is the contribution of my
from the youngers. Perfect. And Dr. Wallace, we'll close with you, and I'll ask you, I heard you made a comment this morning on a call that I think would be really great for everyone to hear about a provider you were speaking with who was a little discouraged about our conversation and some of the good words you shared with them. So would love to have you share that as well.
Yeah, well, I will share with our group who we cut off. We were in the middle of a cliffhanger of a really good story. Alma was sharing with us some vaccine outreach work that she was doing, and how they had gone to a new community, and it seemed obvious that everybody in that community was vaccine hesitant. through a number of experiences, but slowly but surely they started building connections, and more and more people came to their mobile unit, and now they're invited back every 3 weeks, and have been really well received. And so that's a little bit of what we talked about, was just consistency and showing up and becoming a reliable source of information. And I think we experience that in practice with patients as well, is that we are reliable sources of information, and even if it doesn't seem to sink in the first time or in the first conversation, we continue to deliver the message and plant seeds that eventually take root a little bit later. Can't remember specifics from this morning. I'm sorry. I think I was just talking off the cuff, but we do have a lot of really challenging conversations, and some that are threatening, if not directly, then threatening that relationship we have with patients, and I think identity of the providers that we want to be, and that can be really challenging. But I've learned, I guess maybe I should, that through my practice and, having these conversations over and over and over again, I oftentimes feel like they don't work. But just had a medical assistant the other day said, "Dr. Wallace, you're doing a really good job. People are coming in and getting vaccinated." And she told me who had come in to get vaccinated. And it blew my mind, because I thought that person was just an absolute no way. This person will never get vaccinated. And something happened in that individual's personal life, or, obviously outside of the exam room, that led them to rethink the conversation we had. And so they showed up a couple weeks later and asked for the vaccine. So I think there are a lot of opportunities like that out there, but we never see them. We never see that as providers sometimes, because we're just there for 15 minutes and then we're gone.
Yeah, those are great. I know we're out of time, but I'd like to just highlight that study after study has shown that the patient's number one trusted source of information is their primary care provider. So even just like Dr. Wallace shared, even if the conversation isn't going perfectly, keep in the back of your mind, you're up there on the trusted information list, and what you say matters.
Fantastic. I think that's a great way to end this. So absolutely echo that 100%. And, yes, we're here to support and continue and offer resources. And so thank you all so much for your time and for your participation. Keep your eye on your email. You'll be receiving more information about evaluations and how to access the recording and the resources from these events. So thanks, everyone. Have a wonderful afternoon. Take care.